Staggering statistics. October, as we know, Breast Cancer Awareness Month, and our Healthy Morning contributor, Dr. Jane Morgan, is here now with what you need to know about the disease. Let's just start first by saying, I mean, clearly, you know, cancer is something that does not discriminate, right? Race, age, politics, none of that. But who is most at risk for breast cancer in particular?
When we look at breast cancer, and breast cancer, as you state, is the second leading cause of cancer in the United States, and really lung cancer has moved skin cancer out of its #1 position for women. But one of the things that are at risk are oftentimes race is a factor, and Black women are more likely to be diagnosed with breast cancer and also die from breast cancer, but also things like alcohol, family history, smoking. Those are the types of things, including obesity, that we've seen burgeoning in this country, have also been measures that we think are driving the breast cancer rates.
And something that a lot of people don't know is men can get breast cancer as well, right?
Men can also get breast cancer, and the average age of breast cancer for women is 62. Men about the same at about 67 years of age. It is rare, but certainly not unheard of, and the symptoms in men and women are the same. So you can have nipple discharge or thickening of the skin in the nipple and the areola area, or dimpling, pain, lumps. And just like in women, you actually can have cancer for several years before it's actually diagnosed. So it's really important to make certain that you keep up with all of your screening recommendations.
Right, so it's recommended, well, we're talking about that if you're between the ages of 50 and 69-year-olds, you get a regular mammogram.
Right.
I hear about this coach, right, who was 41 when she passed away. That's 10 years from now for me, you know? If you don't have any family history, should you be scanning earlier? Should you be checking earlier or not?
Sure. The Society of Breast Imaging is actually recommending at 40, and most others have lowered it now to 45, just because of this increased risk of breast cancer. But we would start at 45, have a breast imaging or mammogram every other year until 50, and then every year thereafter until you reach an age where your life expectancy is maybe 10 years or less, and then you can perhaps opt out. Certainly the Society of Breast Imaging is also recommending at 40, and anyone can talk with their doctor to begin screening at 40 if they wish. This is a personal conversation to have. It is very unfortunate as well in the younger demographic because the death rate is higher because breast cancers in younger people tend to be more aggressive.
Why? I mean, do we know why?
We need to take a look at that. Obesity, and certainly this has no reflection on the Georgetown coach, but the epidemic of obesity and the toxicity of obesity and the exposure to processed foods for long periods of time, we certainly think is driving up that cancer rate in the younger demographic as well. And so we want to begin to think about all of these things. And certainly if you have a family history or any type of genetic preponderance, make certain that you talk with your doctor. The good news is if you catch it early, stage 0, stage 1, there's almost a 100% cure rate. So think about that, the difference between catching it early and catching it later. So screening mammograms are really important because you can be asymptomatic and not recognize it. And then the other thing is make certain you know what your breasts look like, what they feel like, what's normal.
Because you can check, but if you don't know what's not normal, you have no idea if that's something you should be looking for.
Make certain that you touch yourself, you examine yourself, you know visually what's normal for you. Such that you can point out the abnormalities to a physician. And again, it's important to know what's abnormal for you. So you need to know, you're the only one who knows what your breasts normally look like and what they feel like.
And, you know, I think too, sometimes we like to explain things away. You know, you have this nagging headache, you have this nagging feeling, you know, and it's just like, sometimes you just need to go to the doctor, have that conversation, because early detection is everything.
Absolutely, absolutely. Early detection is absolutely everything. And in this younger and younger and younger demographic, we see an increase in cancer rates, and we really absolutely absolutely want to get on top of it. Make certain that habits such as eating and exercise and alcohol and smoking, you keep all of those in check because they increase your risk of breast cancer.
All right, Dr. Morgan, as always, one of our Healthy Morning contributors. Always appreciate your time and your expertise.
Thank you.
Thank you so much. We'll be back.